So you just had your first exam in community that really emphasized how our dental system is set up and what our dental and hygiene schools look like, as well as our workforce and what it looks like, and how people pay for dental services. So we're moving away from that. And in this unit, so everything that we are going to discuss for your second exam is how we do dental research and epidemiological research. And then we're going to also explore different factors that affect oral health status as well as the usage of dental services. So this is the outline for this particular PowerPoint. We're going to talk about epidemiology, what it is, the core functions, as well as the epidemiological triad and some essential terms. And then we're also going to talk about research and different types of research that epidemiologists do. So that's going to be video one, and then in the second video we're going to talk about the different measures of diseases such as prevalence and incidence and the difference between those, as well as relative risk, and then some other measures as that we see a lot within epidemiology. So what is epidemiology? It is basically a scientific study of the patterns and distributions of diseases, as well as health and different natural social phenomena. And the biggest thing with epidemiology is that it's not manipulating any of these variables or any of these different statuses. Epidemiologists are really concerned about how things occur naturally within society, within groups. They don't really look at individuals at all, but they're actually looking at the community. So they're collecting data within the community, not trying to make individual determinations. So they're really, epidemiologists ultimately, when they apply what they find with these studies, that eventually they're looking at how to control health problems that are within society that are more prevalent within certain populations than others. So this includes different factors of how health and diseases and what they're influenced by. So they look at host factors, which are some of those like demographic types of variables like age and gender, race, as well as immunity status. So they're looking at those type of things and how diseases are patterned within society. They're also looking at the different biological factors, so the different bacteria or viruses or even fungi that are causing diseases. And then they're also looking at the environment. So the physical environment, does a community, is it located near the equator? And does the intensity of the weather there cause certain diseases? Does the community or the neighborhood have certain different pollutants in there that's causing some health issues? Does it have certain radiation issues or events that have happened, like Chernobyl? I think Ms. Myers probably talked about different radiation types of events and how it's affected the community as a result of radiation spills. And then finally, the epidemiologists are also considering lifestyle factors, ways of living. So, do the people within the community, are they more prone to drug and alcohol consumption? Are they more prone to different dietary issues? Do they live in neighborhoods that are considered food deserts where they can't get healthy food choices because of a lack of grocery stores or farmers markets or those type of things? So they're looking at all of those factors, and they're connecting it with health and diseases and how maybe that all sets up for a community to be unhealthy compared to healthier communities. So in terms of functions of epidemiology, they have different functions. The first one is through epidemiological research, we know some normal biological processes that occur. For instance, we know that tooth eruption occurs at certain times within an infant and toddler. So we can predict, based on these normal biological processes, when that tooth is going to erupt. You can also do the same thing with a life course. Like, we know that puberty happens in the preteen, teen stages. We also know that menopause happens in middle age for women. So we know kind of those normal biological processes and how they occur. We also, in terms of epidemiology, and another function of epidemiology is they want to understand the natural history and the progression of diseases. So that kind of leads to, if we know the natural progression or the history of diseases and how they're going to act, then we know what diseases require interventions or not. So for instance, we know just by looking at and observing colds, people getting various colds, we know that they're pretty intense for the first few days, but there's nothing really out there that will help eradicate a cold. You can treat the symptoms, but you can't really get rid of the cold. It has to go through its natural life course. But we also know, in terms of the flu, the natural history of the flu, we know that it typically comes on in the fall, and it peaks in those cold weather months, and then it dissipates during the spring warm-up time. So we understand that we can predict that we're going to have a flu season every winter. And that's because we've observed that natural history of those diseases over time. What's so scary right now, and what has a lot of people up in arms about COVID, is that we don't understand the natural history of this disease because it's so new. We don't know if it's going to come back and be like a flu and it's going to come back every season. We don't know how it's going to act. We don't know how it's going to mutate. We don't know what kind of drugs or interventions are going to be effective against it. So that's what epidemiologists are really kind of focusing on right now in terms of COVID. Another function of epidemiology is that they measure the distribution of disease, and they do that through surveillance, which is that ongoing systematic collection of data. So they measure distributions of diseases, but they also measure and identify determinants of diseases, so those risk factors. So they know kind of age groups are more susceptible to certain diseases, or more gender, which gender is more susceptible, or race and ethnic identity is maybe more susceptible to certain diseases out there. In terms of HIV infections, epidemiologists really focused efforts in the 80s and early 90s on HIV infections and seeing kind of the natural history of that disease and the distribution. And the actual number and proportion in terms of those things, the biggest group that has HIV is still gay men. But if you look at it in a different way and you want to look at the fastest growing population that has HIV, so this population is actually contracting HIV at greater rates than any other populations within the community, is African American women. So that's a different group, a very different group than the actual numbers and proportions of people that have HIV. If you're looking at up and coming group that might be more susceptible to HIV, it's African American women. So they can actually kind of see the trend there. And another function is that they want to test hypotheses. Once they know the history and they know the distribution and the determinants, those risk factors of diseases, then we can kind of turn our attention to prevention and controlling that disease. So we're going to start testing hypotheses and developing oral health, or actually health promotion. Oral health would be a subdivision of this. We're talking about epidemiology in the grander scheme of things in terms of health. So that would be planning and evaluating those health services once they're implemented. A traditional model of infectious disease causation has three components, and it's called the epidemiological triad. And you're actually probably already familiar with this triad whenever you talked about karyology in your theory class or one of your classes that you had. But there are three components to the epidemiological triad. You have that susceptible host, which is basically, it could be a person, the host could be a person, but it could also be, a part of a person as well. It could be influenced by genetics. It could be influenced by those demographic variables that we talked about in terms of age and gender and race and ethnic backgrounds. It could also be influenced by personal lifestyles as well. In terms of the second part of the triad is that external agent. So think about that as the risk factor. Those are the essential things that has to be occurring for the disease to occur. So typically it's more biologic in nature, so the microbiology of bacteria or viruses, but it could also be chemical in nature, like poisons or dosage levels or radiation, as well as mechanical irritants. And then finally you have the environment. That's the third part of the triad, and those are those extrinsic factors, and you can really kind of divide the environment up into two subsections. One is physical, so that would be like geography, like community location and climate, and what's occurring in those neighborhoods in terms of food and water sources and pollution. But then you can also have a social component to the environment. So that could be like the educational attainment within those neighborhoods or the socioeconomic statuses of those neighborhoods, nutritional background of those neighborhoods or cultural backgrounds. Even access to care would fall under the social environment. So if you're applying the triad to caries specifically, what's your susceptible host? And whenever I ask that, I want you to start thinking and twisting that question and saying, what gets a caries lesion? That would be your tooth surface. So your susceptible host is not necessarily just a specific person. You can actually hone it down into a tooth surface there. The external agent, what causes caries lesions? If you think back to micro and biology of head and neck and perio, you'll know that strep mutans and lactobacilli are the two big microbiology agents that cause carious lesions in those two surfaces. And then whenever you move over to the environment, what environmental, if you're thinking about physical, what's going on in your oral cavity to get a carious lesion? That would be that decrease in the pH, that drop in the pH. So it's making your tooth more susceptible. So it kind of all flows into things together. And then when you have all three of those, it's the perfect storm. And that's kind of that middle part where all those circles are overlapping. So whenever you have all three of those, the susceptible host, the agent, as well as the environmental conditions that make it ripe to have a health event occur. So all three of those are kind of overlapping in the middle, and that's when you start getting health and disease issues. You can apply this to any type of disease that's out there. So for instance, let's apply it to COVID. For COVID, who is likely to get COVID? Who's the susceptible host? Well, that's the person, the body. And if you really wanted to hone in on it, the people that are dying from it seem to be having respiratory issues, so it's attacking the lungs. Although there's some new data out there that's saying that it is attacking some other organ systems as well. And then if you look at the external agent, so, what's the virus that's causing COVID? What is the coronavirus? And you can get very specific on that. And then in terms of the environment, physically as well as socially, you have to be within a certain distance for a person-to-person transmission. So somebody that has the virus, whether they know it or not, when they cough or whenever they sneeze or like spit or anything like that, then that's setting up an environment to transmit that virus. So like I said, you can apply this to any disease, and then once you have all three of these different factors in the triad and they overlap one another, that's when you get the disease. Some other epidemiological terms, some of these you might be familiar with, some of them may be new to you, but acute versus chronic should be very familiar to you, especially after perio. Acute just means where a disease begins abruptly. It's very intense, very sharp on the onset, and then it subsides after a relatively short period of time. It's often treatable. So usually it will go away once treatment begins. Chronic, it develops slowly. It persists for a really long time, oftentimes for the lifetime of an individual. And that individual has to learn to manage it, either through medications or lifestyle changes, diet changes, those type of things. Some other terms: epidemic versus endemic versus pandemic. So I think right now we're probably, you keep hearing pandemic throughout the news sources and whatnot in regards to COVID. So this is pandemic just means that it is an epidemic, which, let's just back up. So let's define epidemic first. Epidemic is an unexpectedly large number of cases of disease in a particular population at a particular place and time. So a few years ago, we had an epidemic outbreak of HIV and hepatitis in southern Indiana. And whenever they started looking at the backgrounds of the people that had HIV and hepatitis, the commonality was that there were some IV drug users. So they were spreading the diseases amongst that population. So we had a rash of unexpected large amount of HIV and hepatitis within that particular population. So that's an epidemic. Pandemic is an epidemic, but much more widespread. So it affects a large proportion of geographic populations of a country or a continent or multiple continents or the world. So presently, COVID is a pandemic because it's in Europe, it's in Asia, it's in North America, it's in South America, it's all over, it's in New Zealand, it's, so it's all over the world. So it's very widespread, and all these countries are dealing with how to manage COVID in terms of keeping people healthy, and people that come down with COVID, how to manage that. Endemic is something where the disease occurs on a regular basis within a population, and it happens at a frequent time interval. So it's constantly present, but it's present at relatively low levels. So we expect to see that amount of disease. So it's a usual prevalence of a condition within a population. So in Kentucky Anna, in the spring and the fall, we expect to have a certain amount of allergy issues, which I'm currently dealing with right now. So that's an endemic. Our allergies in this particular area is endemic to this geographical location. In terms of mortality, morbidity, and natality, mortality just means death. So you'll see death statistics, or they'll call them mortality statistics. Morbidity just means a disease state. So people that have health issues will sometimes be featured on morbidity reports. And then natality is just data regarding birth rates. Some other terms, risk and risk factors. Risk is just all about the probability that a health event will occur. So a person will be affected by an illness or an injury or a health condition within a specified time or an age. So there's a probability statistics that a health event is going to occur. A risk factor is an aspect of a personal behavior or environment or genetics that's associated with an increase of disease or health conditions. So basically, a risk factor is a variable that's associated with an increased risk of getting a disease or an infection. So sometimes you'll see those used interchangeably. And there's also some other terminology in terms of risk, like risk incidents, that some people will talk about. And there's very minute differences between all of these different terms. But the biggest one is risk factors and a risk. In terms of specificity and sensitivity, basically, sensitivity is ability of a test, like a blood test or a nasal swab, to identify true cases, meaning that the proportion of the people that have a certain condition that are being identified by a screen, they're getting a positive result. Specificity, on the other hand, is the ability of these tests to exclude people that do not have the health condition or the interest. So basically, this is a proportion of the people without a condition, a health condition, that are correctly identified by the screening or the health test, like a blood test or the nasal swab. So a good test is one that reports a positive result when it correctly identifies antibodies to a particular virus or infection. And that's the sensitivity of a test. A good test is also one that reports a negative result when it doesn't. So it excludes the people that don't have the health condition or interest, and that's the specificity. So it's really interesting. You have to think about the accuracy of the different testing that are out there in terms of like your nasal swabs or the COVID swab. You want that COVID swab to be sensitive and specific. So you want it to be able to tell us those people that do have COVID with accuracy. That's the sensitivity. And then you also want the test to be able to tell us that those people that don't have COVID, and that's the specificity of the test. So moving on to epidemiological research. So we have the terminology behind us, but we also have to be able to do certain research procedures to be able to collect those data. So the purpose to do epidemiological research is to really identify and assess those risk factors and determinants of health, as well as the distribution and the extent of a disease within that population. So basically what it boils down to is that it describes patterns of diseases relative to other variables. That third point is just really reiterating the definition of epidemiology. So when you're talking about patterns of disease, so we know that through epidemiology that carious lesions are really much more predominant in certain populations. So we know that it's more predominant in people of lower income or people with less educational attainment. So through epidemiology and through the research, we can make those associations of carious lesions, that's our disease, relative to some of those variables, demographic variables in terms of income or educational attainment. So epidemiological research, when we do the research, they're utilizing screenings. They are not doing a complete examination to gather the data within the population. That would be much too time consuming and resource consuming. So when we use a screening, it's really identifying the gross needs of that community. And the beauty of utilizing screenings is that it really requires minimal supplies. If you're doing oral health epidemiological research, it typically requires a mirror, a light source, maybe some tongue depressors so that we can see what type of oral health diseases are going on. Epidemiological research is really meant to be descriptive, so it is describing the estimates of oral health status for a defined population. And I put population in that yellowish, orangish font color because, again, it's not intended to make an individual clinical diagnosis or a patient-specific treatment plan. It's really making a diagnosis on a community level. So we're diagnosing groups of people, not individual patients. So there are different types of epidemiological research. There's, if you want to look at it in terms of, there's descriptive and then there's analytical. In terms of descriptive, case studies really fall underneath descriptive. And basically what a case study is that it is describing typically an unusual case. So a practitioner sees something that is an unusual presentation of a disease, and they write it up for their fellow colleagues so that their fellow colleagues can be on the lookout for an atypical presentation of a disease. When we look at analytical, basically analytical means that it's testing hypothesis to establish a causal relationship or a correlational relationship, as well as to identify those risk factors. And we can do that through experiments or observational research. Experiments, we're not going to go into detailed discussion in this specific course. We'll save that for statistics and research design in the fall. But basically, if you recall from chemistry, that experimental means that it is manipulating the independent variables, and then it's collecting data on the dependent variables, and it's controlling for some other variables and whatnot. So typically in epidemiology, we're not doing experiments simply because we want to observe what's happening naturally within the community. And experimental designs really means that you're manipulating different variables. So in observational, we have 3 different types of studies that fall underneath that, and we're going to go into detail on observational epidemiological research. And those include the cohort studies, case control studies, and cross-sectional studies. So my visual people, this is kind of the Venn diagram of how it all, or a flow chart, I shouldn't say a Venn diagram, of how it all interconnects. So let's go into a little bit more detail for those three types of epidemiological research, and then that will finish up this particular video. So the first type of analytical epidemiological observational research is cross-sectional. So cross-sectional is really thought of as providing a snapshot. So if you were to take a picture of that population or that neighborhood, it's going to give us some data in terms of the frequency and characteristics of a disease in a population at one particular point in time. So a lot of times it's really hard to collect data through screenings on every single person within that population. So basically what researchers do is they take a sample from that population and they hope that sample is representative of the entire neighborhood. And they collect the data from those people from the sample, and they start to be able to connect variable of interest, the health status, and diseases simultaneously to see if they're associated with one another. So they're looking at whether age impacts a certain disease, or if educational attainment impacts a certain disease. So they want to see if they're associated with one another. Because they are collecting all this data at once and simultaneously, they cannot derive at a cause and effect relationship. And in fact, you can't really determine causality with any type of these observational methods. Though cause and effect determination is really meant for experimental research designs. So we can determine correlations, whether a variable of interest is associated or is correlated with a certain disease. So for instance, let's say we're really worried about carious lesions in elementary school, and we live in Jefferson County. So if we're doing a cross-sectional type of research design, then what we would do, the research team would go and collect data on certain elementary school kiddos throughout the county. So they would collect the data, and then they would look at their socioeconomic status. They would look at their age. They would look at their food intake. They would look at all these different variables, and then they would see if there were certain variables, whether they're correlated with whether they have carious lesions or not. So that's how we would know if caries in an elementary school population within Jefferson County is much more predominant in lower income families as opposed to higher income families. We would collect all that data at once. In terms of case control epidemiological research is where you have two groups of people, and you are looking at those two groups. One group has the disease, and you call them the cases, and then you're comparing them to the people, the other group, which are the controls. And those are the people without that disease or the condition. So you have these two groups of people, the cases and the controls. And then once you have those two groups of people, you're going to look at their personal histories to determine whether there are risk factors that can be associated with having the disease or not having the disease. Because you're looking at their history, that means that you're doing a retrospective study. The people are enrolled in your research study after the health outcome has occurred, and then you're looking at their history to see if there's something that you can determine to be a risk factor. So, for instance, you are in clinic and you see a white lesion in somebody's mouth, and it's kind of that corrugated lesion, and it's in the vestibule of the mandible. What are some things that you automatically ask the patient? You probably ask if they use tobacco. You probably ask if they specifically use spit tobacco. Then you ask how much they use spit tobacco and how often and how frequently and for how long. So you ask all of those questions because you look at that lesion and you know that lesion, which has been determined through epidemiological research, is associated with tobacco use. So you're looking at your patient's past history to see if tobacco use is a risk factor for them having that white lesion within the mouth. The final type of epidemiological observational research that we're going to talk about is the cohort studies. And instead of looking back at people's histories, we're actually going to follow a group of people over time to see if they develop a disease or not in relationship to being exposed to certain variables. So first you have to define a cohort. A cohort is a group of people that you're collecting data from, and you're collecting data on 2 or more occasions. So typically you collect whenever you start a cohort study, you collect data at the very, very start. And then later on, weeks, months, years later, depending on your study, you're going to collect data again to see if that group of people developed certain diseases. So these are sometimes called prospective studies because you're looking and you're following people into the future. So people are enrolled into the study before the health outcome of interest has occurred. And then you're going to follow them to see if they develop that health or disease, that health issue or that disease. Sometimes cohort studies can be retrospective, but typically they're prospective. So you can also compare a cohort to another cohort that hasn't been exposed to some type of risk factor. So cohort studies are really great in terms of establishing incidence as well as to confirm risk factors that are out there. So typically cohort studies are really time consuming. They can be pretty expensive. But the results are preferred over case control studies because researchers are not looking back into time and relying on a person's memory to give you information. Some examples of cohort studies are all the fluoride studies that we have been doing over the course of the last 70, 80 years. So you can follow people over time that are exposed to fluoride to detect whether they develop carious lesions or not. You could also compare them to a cohort that was not exposed to fluoride and then see the rate of carious lesion development in that group. So you can compare those two cohorts together. A longitudinal study, I put that on here because it's longitudinal happens over time. So it's a study that occurs over a long amount of time, so months or years. It can be really any type of study, but typically cohort studies are notorious for being longitudinal studies. So you can't necessarily use longitudinal studies and cohort studies, those two terms, interchangeably, but just know that cohort studies tend to be longitudinal. So they're collecting data over time. So months, years, decades may pass while they're collecting data. So I obtained this summary slide chart from Christine Beatty French, and she's a very well-known dental hygienist in this area, and I saw her speak at a conference and she gave us permission to use her stuff. So I thought that this was a great chart to summarize all the different epidemiological studies. So in the very left you have the different types of studies that are out there. And then the second column, you have the number of groups. So, for instance, the case control, it says 2 groups. So remember, you have the cases and then you have the controls. Those are our 2 groups there. Cohort studies, you typically have 1. You can have a comparison group, but it's not always necessary. In cross-sectional studies, you only have 1 group. And then the third column, the middle column, is how many times you're collecting data. So in cohort studies, you're collecting data at least twice, but maybe even more. You know, maybe you're collecting it, if it's a 50-year study, maybe you're collecting it 5 times every 10 years. In case control studies, remember that's when we're looking at the history of somebody as whether they've been exposed to certain risk factors. You're only collecting data once. You're only collecting data once in cross-sectional studies as well. The fourth column is a classification and hierarchy. Don't worry about that. We'll talk about that in statistics and research methods. And then finally, the last column is why do we use these types of studies? And you can see cohort studies, we're trying to establish risk, and then we're also trying to establish incidence, which we'll define in the next video. In case control and cross-sectional studies, we're trying to define risk, and then in descriptive studies, we're trying to define prevalence, which we'll also define here in the second video. So that is it for the first video, and this will be continued in the second video.